A warm welcome to all of you joining this webinar from wherever you are. This will be a 2-hour webinar split into 3 sections. The first section we will be listening to a video clip that brings out the voices of communities that were impacted by the Hunger Safety Net program in the regions that the program was implemented. The second session will be a presentation sharing the key insights and highlights from a case study that was undertaken by FSD Kenya in the parts that Hunger Safety Net was implemented. The third and the final session will be a panel discussion that will bring out the insights and experiences from experts that were involved in the implementation of the Hunger Safety Net program. My name is Milka Chebi, a consultant in the area of social protection, climate finance, and women economic empowerment, and I will be moderating this session today. This webinar is a culmination of FSD's involvement in the design and implementation of Hunger Safety Net program in the arid lands of northern Kenya, specifically in Mandera, Wajir, Marsabit, and Turkana. FSD Kenya was at the core of the design at the time, challenged by the UK aid, the DFID, to design a solution, a payment solution that would enable the delivery of payments into those northern regions of the country. At the time, there wasn't any payment service provider. It was limited. It was a difficult terrain. There wasn't any business case for many of the financial service providers to take payment services to the region. After 10 years of implementation, FSD Kenya playing the role of the payment service manager, managing the cash that was to be delivered to the recipients, FSD Kenya went back to the field and undertook a study to find out the impact of those recipients and the economies around the region that the cash transfer was implemented. After another 10 years again, FSD handed over the program successfully to the government of Kenya as part of its sustainability intention. Today, we will hear from experts, their experience, their insights in setting up the Hunger Safety Net program, and share the lessons learned, the successes that they implemented in those regions, and more importantly, giving the future perspectives of the cash transfer programs, especially in the follow-up of the pandemic that hit the country and other global regions within the last 2 years. Cash transfers has become a very enabling tool that can help recipients to cushion them from vulnerability that would come in from any shock responsive. FSD Kenya is an independent trust dedicated to developing financial solutions and supporting Kenya's development agenda. FSD works closely with the government of Kenya, the financial sector, and other partners to develop financial solutions that better address challenges that face the real world, low-income households, enterprises, and the underserved groups such as women and youth. FSD, having been part of the partners that implemented this program 15 years ago, we felt that it would be important to culminate all the lessons we've learned into what we are doing today. And at this point then, I would like to invite Tamara Cook, who is the Chief Executive for FSD Kenya, to give some remarks. Welcome, Tamara.
Thank you, Milka. And it's great to have you and several other FSD Kenya alumni with us today. Plune and Victor, with all 3 of you going on to bigger and brighter things. But it's always great to have you as part of an FSD Kenya event. You know, the thing I really want to emphasize, Milka, you've already told us a little bit about the history of HSNP and even who FSD Kenya is. But what excites me about this case study and about this story is the concept of partnership. FSD Kenya was asked by UK aid to help figure out how to make this work and help bring can bring players together, and you're going to hear more about that story and how that worked from Plune in the presentation later and also in the video. But we have National Drought Management Authority, we've got Equity Bank, we've got FSD Kenya, we've got UK Aid, and we've all come together to tell this story. And some of you will have seen even this week in the newspaper that NDMA is leveraging the Hunger Safety Net program infrastructure to support those who are being affected by the drought right now. I think we've also seen that HSNP, Hunger Safety Net program, is not just about this program, but it's also inspired other work such as Nua Jamii and broader social protection efforts that are happening across Kenya that low income and marginal populations desperately need. Social protection is not just a do-gooder thing. It's about helping people be more resilient, but also contributing to inclusive growth. And you're going to hear much more about those stories today. The last thing I'd like to say is that not only has HSNP inspired agent banking and more social protection work, but it's also supported work in building livelihoods. And some of you may have seen the case study that we did on the Marsabit pilot that was working with recipients of the Hunger Safety Net program, and we'll share some about that as well. But let me get out of the way because we've got a fantastic program ahead of you, and I look forward to hearing all the mini stories we're going to hear from everybody else. Asante Sani Daktari, and back to you.
Asante Sana Tamara, articulating FSD's role in building such platforms that today are being used by other programs in the country, and also just the key issue around partnership, because this program would not have been successful and other programs that are largely happening now would not have been successful without stakeholders engagement and coordination around that. Thank you very much. I do want to remind us that please you follow us. You follow this conversation on our Twitter handle. It's already posted in the chat box. If it is not, it's FSD Kenya, using the hashtag social protection at KE. And also, if you have any questions that will arise during the course of this webinar, please do put them on the chat and we'll be able to respond at the Q&A session. We could move to the next session, which would have been session 2 on the presentation. Plune, we will introduce you so that you can take that session. So as I mentioned earlier, there was a case study that was undertaken in the regions that FSD implemented this Hunger Safety Net program, and Plune Oyunge will be sharing with us a presentation on key successes and lessons learned. Plune Oyunge is a digital finance practitioner with over 10 years experience in designing and implementing innovative financial strategies in the financial sector, particularly for the unbanked. Working at the intersection of finance and technology, Plune has been keen to contribute to design and deployment of inclusive payment systems. And she has worked with various stakeholders, particularly around the government sector and the donor world. With academic credentials in information technology, Plune is recently joined the Integrated Payment Services Limited, the IPSL, as the Chief Transformation Officer, overseeing and leading the change in that organization. She was the payment service manager for the Hunger Safety Net program, involved in the recruitment, involved in the field work, and therefore Plune is really critical in sharing our insights beside the presentation today. Welcome, Plune, and take it on from there.
Thank you very much, Milka, for the kind introduction. And thank you to all the attendees who have joined our webinar today. Today, I'm very excited to share, to be here to present some of the learnings from HSNP, our involvement as FSD then, in the HSNP project. It's a project that is very close to my heart. So after 10 years of implementation, I'm glad to be back to share our learnings. In terms of what we'll cover in my presentation, we'll talk about the background, in terms of what is HSNP, what was the motivation behind it, how did FSD get involved in, as a PSM, what were our objectives. We'll talk about some of the design features of HSNP, both for phase 1 and phase 2, As we go through the project, through the presentation, you will see that there were two phases of this project where FSD was involved in. We'll talk about some of the stakeholders that were involved in the project and the role that they played. Obviously, such a project, over a period of 10 years, there's definitely going to be challenges. I will share some of our insights on, our key challenges, what we achieved during the period, and at the end, we're going to discuss about the key learnings. So a bit of background on what HSNP is. HSNP, for those who don't know, stands for the Hunger Safety Net program. And from what we've heard from Milka and also Tamara, it was born out of a need for government together with the donor agencies, in this case, FCDO, and at the time they're called the DFID, to put $20 in the hands of a beneficiary, of a person in northern Kenya. This was a big challenge, and I will show you why and how in the next few slides. Another objective of HSNP, or how it came into being, was the need for FSD to contribute to the expansion of financial services in northern Kenya. At the time, exclusion rate was at 40%. And I will show you where we were at 2019, or even as at 2021. And finally, another objective was to contribute to the development of the National Social Protection Framework, which at the time was not in existence. Now, I don't know where our participants are joining us from, but a bit of context on northern Kenya. And where this project was implemented, that is in 4 of the poorest counties in northern Kenya. That is Marsabit, Mandera, Wajir, and Turkana. So these are the 4, at the time, were the 4 poorest counties in northern Kenya. And this was in the Asal region. Asal is arid and semi-arid region. So some of the characteristics of this of an Asal region, and I think that's generally speaking, is that there are poor households in such a region. They're routinely food insecure, so we expect high levels of malnutrition. The place is sparsely populated, and we'll see how this contributed to some of the challenges that we faced through implementation. Again, Asal region historically received very minimum development support from government and other communities, such as the donor community, and this results into poor infrastructure, some of the things that are very critical to development of financial sector financial sector in such an area. Then again, very weak financial systems. Business models were not viable at the time for banks to go into such areas. So I think we had about 2 banks only playing in northern Kenya. Very poor access to basic services such as health, education, and water. So, this is just to try and paint the context in which we were operating. Obviously, this made it very difficult to set up any infrastructure or any sort of program in that area. So we've spoken a bit about the challenge fund. The challenge was to put $20 in the hands of somebody in northern Kenya. Obviously, this now expanded to 3 other counties, which I have explained. This was going to be a bi-monthly support, and the challenge was to do this cost effectively, a big challenge. What did we do? We, as FSD, we set up a challenge fund, and this was done together with FCDO, and we went out and told guys, how do you think we can deliver $20? We can put $20 in the hands of a person in northern Kenya. Give us ideas. So the challenge was set out, and we received a number of proposals, both from banks and non-banks, some fintechs at the time, and we sat together and put together a terms of reference, and this was done together with some experts in the payment area. A very interesting model came up from one of the bidders, which was a sort of agency banking model. At the time, this had not been. This is in 2007. So this had not been approved. It was not there in Kenya. So, that was very interesting. And therefore we put this as part of the terms of reference, which was a key design principle for us. And that was a challenge. For FSD, specifically, why did we get into, what were the main objectives for us? We wanted to digitize the cash transfers. We all know about the disadvantages of delivering cash transfers manually. We're talking about, there's no flexibility, timeliness is very hard to keep up with, there's no accountability, there's no transparency. So of course that may lead to leakages across the value chain. So we really sought to digitize cash transfers, and this was part of the design principles. We also sought to look into the area of financial literacy and financial inclusion. As I mentioned, at the time in 2007, exclusion rate in Northern Kenya especially was very high, and across the country it was about 40%. We also wanted to leverage private sector to deliver payments. Before that, government used to do it by themselves. So what they would do is to track cash across Northern Kenya or any other area that needed support, and this would take forever. It would be very inefficient in terms of cost, in terms of time, and of course the things we talked about in terms of transparency and accountability would not be there. So we wanted to leverage private sector because we believed they had the necessary skills to do this. We also wanted to displace relief food because we believed that it contributed to suppressed markets. Some of the food that was given was not the right ones for the community. So what we saw happening is that beneficiaries or communities would receive relief food and end up selling to get money to buy exactly what they want. They would pick the food and not use it because it was not the right one. So we thought we'd go out and figure out what is the best way of delivering support instead of relief food. So what was the role of FSD Kenya in all this? We've talked about the design of the solution. So we were heavily involved in the design, as I said, right from the challenge fund into putting together what we thought was an optimal solution at the time. That was in 2007. That was for phase one, and we'll talk about the design features for the first phase of the project. We were also in charge of, and when I say we, I mean FSD, even though I'm not part of them at the moment. So secondly, we were in charge of procurement for the payment service provider. So that meant contracting the PSP, that's writing out the terms of reference, contracting doing the assessment, the round of assessments, and then contracting management of the PSP. And of course, we also had a role around service level agreements. We also supported the rollout of the solution. What does this mean? It means working very, very closely with the payment service provider to know what is needed. What are the timelines? Do you have the right resources in place to make sure that the solution is rolled out in good time? You have the beneficiaries on board, you have the right technology, working very, very closely with the payment service provider. I've talked about SLA management. The next one was on fiduciary risk responsibility, which FSD took up as part of this work, although at the onset, this was not set to be an FSD responsibility, but we took it up anyway. And what this meant was we needed to put enough measures in place to ensure that there was no risk within, in the end-to-end processing of the cash transfers. So what we did is we did an end-to-end risk assessment. And what that means is just ensuring that we put in, we identified all the risks, inherent risks in the solution, and we put in measures to ensure that there was no loss or to minimize as much as possible the risk of loss of funds, and of course to make sure that the funds reached the intended person and that they were used for the right reasons. A very key for us, again, was capacity building and final handover to GOK, as I will show you in the following slides. As we got in as FSD, the intention was always to get in, create capacity, and get out. We never sought to be there for too long. So that from the onset, that was very key, and it was always on our mind. How do we ensure that we are here for the for minimum time? And after a few years, we moved out, or rather we handed over to government. So we are not the only ones who are involved in implementation of this project. This was a huge undertaking by both government, FSD, all the other partners that were involved at different times during implementation of the project. FCDO sitting at the top, obviously this they were responsible for funding. In the first phase, they funded the project 100%. Of course, in the second phase, government also came in. So we have FCDO there as funding, and then Government of Kenya, very important for an undertaking such as this one. You cannot go into communities, you don't know who you're targeting, you don't know who you're paying, you cannot identify them. So they were very key in terms of telling us who is the person that is supposed to be targeted, who's the person who's the most vulnerable in this community. Obviously, because of budgetary constraints, this was not going to be, a payment made to everybody, but the program did try to do it. So targeting, again, funding during phase 2, there was a bit of governance and implementation, and also monitoring. I've talked about the role of FSD Kenya. Equity Bank as the payment service provider, what was their role? Very key. Right from opening bank accounts for beneficiaries, issuing cards, replacing cards, making sure they have set up agents, across the 4 counties, liquidity management, making sure that these agents were not just set up, but they had sufficient money to make sure that whenever beneficiaries required to get their money, then they would get. It's a very, very intense undertaking on their side. Obviously, again, also on reporting, and they also provided first-level case management on payment-related matters. We did have other partners like Oxford Policy Management, that is OPM, that were responsible for monitoring and evaluation. HelpAge, and also HelpAge International, who were responsible for complaints, for setting up a complaints and grievances system. And Pilu was set up to manage the transition of the project to ADMA. So what were the design features, key design features? There were a number, but I'm going to call out just 4. One was prepaid cards. So all our beneficiaries were issued with prepaid cards, and this was, it was a form factor. It was supposed to be what they would use to access their money. And these were biometric enabled. And again, the agency banking model that came into play during the first phase. But in the first phase, the agents were dedicated. So that meant that selected beneficiaries could only get money from specific agents. By end of the first phase, about 69,000 households had been paid. So we went into phase 2. What were FSD's objectives as we went into phase 2? Obviously, this was based on learnings across the first 4 years of implementation. The main one was to commercialize the model. We had, the first phase was we're trying to prove. This was a pilot. It was a pilot phase. So out of the learnings that we got from phase 1, we realized we could actually commercialize the model, especially in terms of the agents. So this, in the second phase, we opened up the agent network, and what that meant is that beneficiaries would go to any Equity Bank agent. By that time, agency model had already been approved in Kenya. That was in 2010, and therefore, beneficiaries could we had more number of agents in Northern Kenya, and beneficiaries were able to go to any of them. And they were not limited to their counties, or even across the counties. Another one was on full bank accounts, very, very interesting. So the first one, like I said, the model was based on a prepaid card. So the funds were held in the prepaid card in a sense. Moving into the second phase, and with FSD's mandate to expand financial inclusion, we figured, let's open bank accounts for all our beneficiaries, and that's exactly what we did. So there were two groups of beneficiaries. One, we'd call them Group 1, and these beneficiaries that would receive money every 2 months. Then we had a second group of people, and because again of budgetary constraints, this group would only receive money when there was, as part of an emergency response. But we opened accounts for over 300,000, almost 400,000 households. And that is what we call the response mechanism. So we had a group that, every month every 2 months they'd receive money, but in case of an emergency, we would quickly activate the response mechanism for the other group. That is the Group 2. And again, provide a mechanism for graduation. We also found that beneficiaries who are in the first phase were not always. It's not all of them that graduated into phase 2. So some of them dropped because they were able to do support, and they sort of moved up the scale, and they moved out of poverty, out of the poverty rank that would receive money every other month. And sustainability, which I have also talked about in terms of capacity building and handover to government. Challenges and a number, but I'm going to just speak to a few today. One was in terms of coordination with the number of stakeholders that I have shown you. There's, everybody has their own, they're bringing different things to the table, and they have different interests. So coordination was a problem, and we needed to work together. Heavy costs when it came to field work. KYC was an issue, and especially in Northern Kenya, where not everybody had an ID, and this was mandatory for account opening. Migratory nature of the beneficiaries. I've told you about the sort of, I laid out the context in terms of what does Northern Kenya look like, and some of the issues that would cause migratory behavior. So you'd sometimes go to, you plan to open bank accounts in a certain area, and you find out that morning that an entire household or village decided to migrate the day before. Low literacy levels, of course, and of course, lack of viable commercial enterprises to be enrolled as agents. A lot of achievements. I'll pick a few. We were able to digitize the cash transfers. Financial inclusion, of course, went up because now we're opening bank accounts. We were able to leverage on private sector to deliver this because of the work that we did with Equity Bank and government, and also stimulate interest for other commercial banks. Right now, there are about 5 or 6 commercial banks that have moved in to Northern Kenya because of HSNP. Allow me to move very quickly because of time. I can see I'm being alerted. What were our key learnings? Innovation is critical. The context in Northern Kenya is, it's very difficult to work with. So if it was not for innovation, I don't think we would have been able to do much. So it just calls for, just thinking, and with technology, it has become easier. How do you bring down the cost? How do you bring in efficiencies through, throughout the delivery of those payments? Cooperation and coordination, which I've already spoken to. There's a need for flexibility. I know there were very many times when we went, we had a plan. We knew exactly when we were going into open bank accounts, when we would be ready to make payments, but it was not possible because of, like we say in Kenya, Vituko ground any different. You get there and it's raining, insecurity and so many other issues that make it difficult. Government buy-in is critical. They're bringing in funding, they're bringing in their people, their resources on the ground. They're putting in budgetary, they're putting in a budget towards implementation of this. There's need to really work together across all the partners that are involved. Most important, I think, is sustainability. We knew what we wanted. We would, as FSD Kenya, we knew we're not going to stay there for long. So our work was sort of laid before us. We knew we were not going to stay there for long. So that was already in our minds as we were going in, which is very important because we've seen projects sometimes that, you set up projects and you're not sure what's going to happen when I leave. Yeah, that brings me to the end of what would have been a very long presentation, Milka. But this was just to paint an insight into some of our learnings, some of our experiences in the implementation of the project. There is a report that goes into much more detail, the video, and I think there are other outputs that came out of this work. Thank you very much, Milka.
Thank you very much. Plum, I can feel the passion. You've been there for more than 8 years, starting from zero to where we are today. So putting all that into a 10-minute presentation, we are sorry about that, but thank you. That was very interesting insights from you. And I like the part you talked about innovation. Let's innovate a lot, the role of fintechs coming in there, and just the collaboration around the relationships that you were managing, multi-stakeholder relationships that you're managing. You named very many of them, and I know that must have taken much of the time to do the design and implementation of the program. I will now invite back Nancy to bring us back to the video clip. Nancy, if you are ready, you can pull it up. Meanwhile, very encouraging questions coming on the chat. Please continue putting them there. We will be able to share some responses.
The role of FSD Kenya for HSNP was that of a payment service manager. And that included, to start with, the design of the payment solution. So both in the first phase and the second phase of HSNP, FSD was the one designing the payment solution.
The role of FSD in developing a solution for HSNP began with what I would call a challenge from DFID, where they asked us to place $20 in the pocket of a person in Turkana on a regular basis every 2 months, and to make it affordable. What we did was we set up what today is known as agency banking. At that time, there was no agency banking in Kenya, but with a special dispensation from the Central Bank of Kenya, we're able to set up an agent in Turkana, in Kakuma, and we registered about 500 initially beneficiaries using biometrics, because we wanted to make sure that we were able to positively identify and authenticate the individuals or beneficiaries who are receiving these funds. And also we wanted to make sure that this was a process that could be used by people who are not literate. We then went out and advertised for a payment service provider, somebody to come in and help us to roll out the solution. And out of about 18 applications, Equity Bank emerged as the best candidate. So we're looking for a partner who was really keen to work with the bottom of the pyramid and to continue to develop solutions for the people of Northern Kenya.
In terms of payment processing, FSD Kenya was responsible for just making sure that the payroll was in order, coming from government, and making sure that the funds that were coming from FCDO and also from government in the second phase were processed in good time and delivered in good time. There was also another role around SLA management, that is the service level agreement. These are agreements that were part of the contract, and FSD's role was to ensure that these had been maintained by the payment service provider, both from a beneficiary point of view and in delivery of the payment. One of the things that we did was to do a beneficiary satisfaction survey, basically going out to beneficiaries and asking, are you satisfied with the service that you're receiving? From the payment service provider side, we were to ensure that the payments were delivered in good time, accounts were opened in good time, cards were delivered also within the framework that we had agreed on. Some of the key design principles that we took into consideration, especially in the design of HSNP, were one, predictability and timeliness of payments. In a program such as a cash transfer program, it's important that you get the payments out on time. So in the case of HSNP, we were able to pay on the 5th of every payment month. Another key design principle, I'd say, is keeping personal data of the customer, private, especially in the age of internet, where some of this personal data can be misused for fraud or other things. It's important that you ensure that this is covered. The other thing is accessibility, ensuring that beneficiaries are not walking long distances to get to a payment point was key for us. There was an SLA requirement around making sure that 80% of beneficiaries lived within 20 kilometers of a payment point, which was adhered to.
Hawa mama wakifika, ako na ATM card na kitambulisho. Kwa hizi zote mbili unahakikisha majina yenye yako kwa kitambulisho na yale yenye yako kwenye kadi ya ATM zinafanana. Kisha utachukua kadi uingize kwenye machine. Ukishaweka itakuitisha kidole. Utachukua kidole chake uegeze kwenye machine. Kisha ita-verify. Kisha verify utaweka pesa. Ni shilingi 5,400. Kisha toka utamlipa pesa. Kisha tuko na kitabu ya benki, unaandika maandishi. Utaandika majina yake, ile pesa amepata na kuna na hiyo transaction.
Pesa ikikuja, agent inapiga simu. Wanasema wenye wanapatanga pesa ya lopetuni, wanatakana wapate pesa tarehe fulani. Chifu kwanza ndio anatangulia. Nasema pesa ya lopetuni imekuja, itapatikana tarehe fulani. Agent anasema msanya watu wote wakuje tarehe fulani wapate pesa. Nilikuwa napokea 4,000 sijui na 100 ngapi. Alafu wakarudi tena wakaongeza. Saa hii tunapokea 5,400.
Some of the challenges in implementation of the HSNP program is about the IDs, and we saw this when we were opening bank accounts in the second phase. Once we set out to open the bank accounts, we realized about 40% of the beneficiaries did not have IDs, and that sort of set us back in terms of our work plan and in opening those accounts. One other challenge is about getting viable agents at the time when we were starting, because the businesses were quite small, and depending on the amount of money they were paying out, then that could be a challenge. So that was an issue. But currently we have about over 500 agents across the 4 counties that are serving beneficiaries.
The program has had very positive impacts. Each time there's a drought, the household lose assets, and poverty increases in those households, because now you've lost your sources of income, livelihood. In the households where we have this program going on, the poverty did not increase as much as it did in the other households that were not benefiting. Regardless of whatever was happening, the shocks and all this, at least they could eat. They could have something to eat because they had cash, they knew the cash was coming, it was predictable.
We have seen economic impact to our vulnerable households. The money that the household gets can utilize from other things. The household can buy foodstuffs, The household can purchase medical supplies for ill household members. The household can venture into small-scale businesses. And that has brought a shift from dependent population to what I may call resilient.
Hii pesa nimefungulia naye kibanda. Nimeweka mabasta, nimeweka unga, nimeweka nini, kila kitu tu iko, hata peremende. Hii pesa inanisaidianga saa zingine natuma kwa shule. Saa zingine kama maneno ya shule ijokuja nanunulia vitu naweka kwa duka.
Evidence shows us that providing cash is actually between 2 to 7 times more efficient than providing food assistance or food aid, which was one of the key objectives of the program at the very beginning. Cash transfers have also been shown to have wider impacts, including on supporting the local economy and supporting the local markets and small traders within the communities that are affected. Use of cash has been shown to preserve dignity of the individuals or the beneficiaries, and has been also shown to have a very positive effect on their mental well-being during a crisis.
Mimi, huu mradi umenisaidia sana. Kuna ile commission mimi napewa baada ya kulipa hawa mama kila tarehe 6. Nikienda kule benki na nashukuru Mungu kwa sababu imeniinua. Pia imefanya biashara yangu imeimarika kwa sababu wakati nilianza kama ka kiosk kadogo. Wakati watu wanapata pesa they buy. Wamefanya sasa niko saizi na duka 2. Pia imenisaidia kwa sasa ninauza retail wholesale kutoka kwa kioski na kupima sukari ya shilingi 10. Saizi naweza pima gunia niuze nusu gunia, niuze quarter ya gunia.
Since phase 1 of cash transfer program, a lot of lessons have been learned. There would be need to complement cash transfers with capacity building. Cash payments are not sufficient to transform people. They solve instant problems, but if we did capacity building, then we could put the beneficiaries on a path of self-sustainability.
So in terms of lessons learned is having the community support the project, because initially when we went into northern Kenya, there was a lot of resistance initially to the program. So we brought in, I would call them local elders, etc., to talk to the communities. And once they spoke to them and we got their support, that changed the perception of HSNP.
Sustainability was a key success for us. The original intention was that once FSD exits the program, that the program will continue running. And this has been the case after 2 phases of running or implementing, being part of the project as a payment service provider. We transitioned successfully to National Drought Management Authority, which is now the program or the agency that is running the program, and it's doing so successfully.
Namwambia hii watu asante sana, sana sana sana. Mwambia hao asante sana. Kama wako na uwezo ya kusaidia tu tena aongezee sisi pesa, aongezee.
A very powerful, compelling story from communities that received the cash transfers in the northern parts of Kenya. And what a finishing line from that lady that is saying, thank you very much. And if there are opportunities, we should increase the wallet for them. Very interesting feedback from the ground. We will now move to the panel discussion, our last session of the webinar. And we will bring in 4 experts to this panel discussion, and I will start with the introduction of Saralyn Wairimu. Saralyn Wairimu is the General Manager at the Equity Bank Group. She has over 18 years experience cutting across the banking sector, the social protection, and the social assistance programs. She played a key role in the development of refugee and response framework that advocates for durable solutions, sustainable financing, and self-reliance of the forcibly displaced communities. She is responsible for key partnership across the continent, from Uganda, Rwanda, DRC, Tanzania, Southern Sudan, and of course, Kenya. With academic credentials in finance and mathematics, Saralyn is currently pursuing a PhD program. Equity Bank was at the center of the deployment of payments, and Saralyn will be articulating our responses as an implementer and as well as the vision of Equity Bank in deploying safety net programs across the country. Welcome, Saralyn. Our second panelist is Victor Malu. Victor is the founder of Future Systems Consulting Limited, providing technical and strategic support in the development of financial systems, with over 25 years in banking sector and 15 years in development sector. Victor has been at the forefront in implementing tremendous impact on policy and regulations, digital financial for payments, and recently affordable housing programs. Victor was the lead person in the design and implementation of the Hunger Safety Net program. He was carrying the challenge card to put the $20 in the arms of beneficiaries in the remotest parts of Kenya. A certified digital finance practitioner, Victor is keen to deepen financial literacy across the country while improving tomorrow's financial systems today. I will move next to Anthony Njage. Anthony is the team leader for the Resilience, Equity and Inclusion team at the British High Commission. In this role, he has led UK policy and programming on the Leave No One Behind development agenda in Kenya, focusing on the poorest and most vulnerable groups. This role entails policy and programming interventions on social protection, resilience, and equity. And he is also the senior responsible owner for the Hunger Safety Net £70 million budget. He has overseen the program evolution from a donor-funded to a Government of Kenya flagship program. Anthony is passionate about delivery systems and its enabling responsiveness and effectiveness of social protection. Welcome, Anthony. I will now move to introduce Engineer Jirma, representing the Government of Kenya. Engineer Jirma is the Deputy Director for Drought Resilience at the Kenya National Drought Management Authority, the NDMA. In his previous professional engagements, Engineer Jirma also worked with the Codate International, providing technical support and advice to Codate partners and communities in Northern Kenya and Southern Ethiopia on water and sanitation and hygiene and community managed disaster risk reduction. The Master of Science graduate from Lathrop University, UK, has key expertise in Kenya's urban and rural water supply, Hunger Safety Net program, disaster risk analysis and programming, and coordination in early warning information systems. He was part of the team that formulated the country's national disaster risk financing strategy and development of guidelines that steered the country from in-kind support to cash-based solutions. Welcome, Engineer Jirma. I will now kick off this session with our first question that will go to Equity Bank Group, represented by Saralyn Wairimu. Saralyn, at the time of initiating the cash transfer programs in Kenya, there was little interest from the financial service sector players. What was Equity's motivation in going into social payment, especially Hunger Safety Net, in areas that really attracted low financial profit and also infrastructure at the time? Saralyn?
Thank you very much, Milka, and good evening, good morning, good afternoon to our listeners. Thank you for that question around what would be the motivation for Equity Bank to execute this program within the circumstances. And I'll answer this question with 2 points. And number 1 is around Equity's essence of existence. And that boils down to our corporate philosophies, our vision, our mission, our purpose, and particularly our purpose, which is transforming lives, giving dignity, and expanding opportunities for wealth creation. Our mission is around offering integrated financial services that socially and economically empower consumers, businesses, and communities. And our vision is to be the champion of the socio-economic prosperity of the people of Africa. So when you look at that essence of existence, then that speaks to the drive and the aspiration, or why the ambition to get into such a venture. So our drive was basically around the quest for transforming lives, empowering individuals, empowering households, empowering communities. And when you look at that aspiration, you'll see quite an overlap with the social protection objectives in broad, areas around poverty reduction, addressing inequalities, promoting inclusion and empowerment, and more specifically looking at HSNP program objectives around eliminating hunger, reducing poverty, and vulnerability for poor households. You see quite a bit of overlap in aspirations or in objectives. And so when FSD came to us and gave us an opportunity to serve in this program, we looked at it, of course, from not just a commercial lens, but most significantly from a social lens. And that brings me to my second point around our model. So our model is formed on a number of parameters, and one of them is what we call the dual engine model. Dual engine meaning that within our executions, we have aspirations around social impact, as well as economic impact or commercial impact. And that explains why in the year 2008, we formed the Equity Group Foundation, which focuses on a number of pillars, and social protection being one of them. So when you look at that model, it also brings us to what we call purpose-first execution model, where we place doing good ahead of doing well. So looking at the hunger safety net program, we looked at vulnerable communities, and at that point we were coming in strongly to democratize access to financial services. You will recall by the time Equity Bank was coming to the scene, a lot of our population in Kenya remained unbanked or underbanked. And we came in to really change that landscape by democratizing access to financial services, bringing the underbanked and the unbanked to the formal economy and integrating them into formal financial services. So within that anchorage on inclusivity and a number of models around removing the barriers to financial inclusion, you will recall by then there were a lot of requirements. If one was to open a bank account, issues around KYC compliance, fees and charges, and of course other non-financial barriers. And so in our role to really democratize the financial sector space, of the financial inclusion space, we came in and removed those barriers. So within that same aspiration to extend provision, open up our doors to the underbanked, the underprivileged, the vulnerable, we got this opportunity as well to then serve the hunger safety net program. And so we came in, brought in the same model of affordability, bringing in a lot of innovation that enables us to serve mass markets, bringing that banking population all the way from 4% upwards to where we are currently. So that aspiration and the model itself of our existence and the very essence of why we exist is what brought us to a point where we said, let's give this an opportunity. Let's get in there, not just from a commercial angle, but let's look at the social impact first and prioritize that. And of course, we have the mantra around doing well while doing good. So you do good, and the commercial sense follows that, or the benefits then follow you. A lot of other models that have been mentioned within the presentation and submissions at the beginning of this webinar Kenya in terms of shared prosperity. Our model revolves around wanting to bring in other players or other persons who can benefit from our executions. So issues around agency banking, when we proposed that, it was again based on the aspiration to bring in prosperity to our partners. Partnerships and collaborations, a model around convenience and accessibility. So when we were given the challenge, for us, we thought this is a challenge that then enables us to bring about or to actualize the strategy that we are having towards inclusivity, towards shared prosperity, towards increased partnerships, towards bringing a solution that is bringing convenience, accessibility, choice, and flexibility and all that. So it was within that premise then that we decided to take the opportunity up. And of course, we have been executing the program to date, which gives us a lot of joy in terms of the social and economic impact that the program has had to date. Thank you. Thank you, Milka.
Thank you, Saralyn. Interesting mantra there. Do good, and the financials will follow. Victor Malus, are you in, Victor?
Yes.
Formal financial inclusion in Kenya, Victor, moved from 26.7% in 2006 to 83.7% in 2021, according to the FinAccess report, significantly driven by mobile money and digital solutions that have evolved in the country. How do we ensure that the digital revolution that is currently happening does not create digital exclusion for some sections of our populations?
Thank you. Thank you very much for that question, Milka, and a warm welcome to all the participants to this webinar. In terms of exclusion, and as you mentioned, Kenya has made tremendous progress, and we are really privileged to have been part of that journey in bringing inclusion to the remotest corners of this country. In my view, there are two things that are really important for us to make sure that we do not leave certain pockets or individuals behind. One of them is around identity. We do have a very robust and very dependable system of identity in Kenya. We now have the national ID, which has been there for since the 30s, and now we also have the Huduma number. The challenge I think we have is, and Plune mentioned this during her presentation, we did find in northern Kenya sometimes ID exclusion was as high as 40%. And we gave people years. We told them during HSNP 1, please go out and get IDs, because in phase 2, you will not be able to enroll, or you will not be registered unless you have an ID. We still found exclusion to be very high when we went back and had to literally stop HSNP 2 and start another project to support individuals to access IDs. We brought in the National Registration Bureau, and FCDO were very gracious and supported funding for this project to literally drive officials to different villages and try to register and issue as many identity cards as possible, so that Equity Bank could then be able to open the necessary bank accounts. So that is one issue that I believe needs to be addressed. And one solution could be the EDA system in India, where by being registered in that system, it does not confer citizenship. Because what we found, especially in the border counties who are operating in Mandera, in Marsabit, you have Ethiopians, you have Somali, you have Sudanese, you have Ugandans, and there's always a concern that this person may not be a citizen. So conferring an ID is a fairly lengthy, complicated process. So my recommendation would be to look for ways to be able to KYC individuals without necessarily conferring on them citizenship, like the EDA system. The second area that I believe needs to be addressed, and this is something we found, is that there are some pockets of exclusion. You have some islands on Tana River, some on Lake Victoria. You have, even in northern Kenya, we had some challenges setting up agents in some very remote corners. It's actually a very vast territory and incredibly deficit of infrastructure and other modern amenities that we, I believe in Nairobi, take for granted. So that's another, so we need to come up with models like the mobile money fund, where this fund is being used to set up towers in very uneconomic locations. and it's sort of subsidized. So all the mobile money providers put money into a kitty, and one of them can access those funds and then put up a tower. So I believe those models need to be expanded so that more and more regions can be able to access networks, because solar energy is much easier to provide than network connectivity. So those are my two quick suggestions that can really support and avoid having these pockets of exclusion. There are other areas like gender, youth, etc. But I think at the high level, we need to look at identity and regional disparities in access. Thank you.
Thank you. Thank you, Victor, for articulating that question. So I'll move to Engineer Jirma. Engineer Jirma, representing the government of Kenya. Providing fiscal space for social protection and safety nets in the country really requires a lot of funding. And just like CEO Tamara mentioned earlier, that there was about 1.1 billion just being sent to the remote parts to respond to the shock responsive that is out there. What measures have the government of Kenya put in place to secure funding, scaling, and sustainability of the program, and also the welfare of the hunger safety net recipients? Engineer.
Thank you, Milka. Good afternoon, good morning, and good evening to the participants. Based on the question, I will approach the question into 5 approaches that the government is using to ensure we have sustainability in as far as resource allocation, funding, bringing on board the beneficiaries concerned. One way of ensuring sustainability that the government has done was to move from the project approach that HSNP started from to institutionalizing it. Interestingly, during phase 1 and phase 2 was also the constitutional moment of this country. So it was an opportunity actually to embed Bill of Rights, social protection issue into the constitution, and it was very clearly articulated. That gave us an opportunity to build up on that. Then there was an opportunity of now forming National Drought Management Authority as an institution that is capable of now taking over and rolling it. Now, NDMA had a clear mandate of establishing system and mechanism. And the best mechanism and system that NDMA was able to pick up and actually run away with was the HSNP cash transfer system. And it echoed very well with the new institution's mandate. So that actually created a good institutionalization of the cash transfer. Then the policy framework was also a very good opportunity. Because of the dynamism of the cash transfer, we had a social protection policy conversation which was going on, and it was an opportunity to actually bring in a new pillar, which is called shock responsive, rather than the traditional 3-pillar of social assistance, core social protection, health issues. So that also was able to influence the policy environment and thinking of the government of Kenya towards bringing shock responsive as a clear pillar in social protection that institutionalized now the hunger safety net. You have the institutionalization, but now where is the fund coming from? Which is the critical thing. Also, to fund a program, you can do through the normal project approach where you pitch through the sector. It's part and parcel of the vision of a country, like in our case, Vision 2030, the Big 4 agenda echoes very well with the program. So it was very easy for us to pitch under that through the normal sector and MTP process. However, that is just not enough. Can we have a legal framework also to have dedicated resources that when there are issues of fiscal challenges, that the cash transfer, especially for the vulnerable, is dedicated? So what have we done in the social protection policy conversation? We are thinking of establishing a social assistance fund that possibly various HSNP or any other cash transfer can tap into. We also went out of the way as government and supported the formation of the National Drought Emergency Fund, which is also a legal instrument that dedicated resources. And interestingly, the NDF has a seed capital of 2 billion, of which 10% is dedicated for HSNP. So in addition to the sector budget, the annual budget process, you can also tap into this financing instrument that has a dedicated resources and you also pitch for resources, just like the way the project will be resources, but on the side. Now, the other aspect is the risk financing is becoming an issue for the National Treasury. So we went out of our way and engaged with the National Treasury in coming up, especially for the shock responsive component, it can be very expensive. For regular, it can be predictable, you can budget. For the social responsive component, it can be unpredictable. You don't know the extent, the secondary hazards can come on board and the station can go out of control. So how do we ensure that the National Treasury has the capacity to avail resources that the scalability component is done? So we engaged, and with the support through World Bank and FCDO, we formed the National Disaster Risk Financing Strategy for this country, for disaster, for scale-ups. And that came out with very many instruments which are layered. You use instrument one, which is the normal project support. Can you bring up on board possibly the National Drought Emergency Fund as another instrument? Beyond that, can you bring risk transfer so that you can offload those fiscal risks to a private sector? That came out in the financing strategy and it is being piloted. Then we had an opportunity of also tapping into a World Bank risk financing instrument called FCDO. And it became a very good learning for us under the disaster risk financing strategy that we could tap that financing instrument within the framework of the National Disaster Risk Financing Strategy of the National Treasury to support shock responsive, in this case, COVID, and reduce the pressure for drought, which was also ongoing. Locust was just happened. The government had responded. Drought was hitting. Then COVID came. So how do we ensure that at least we allow the National Treasury also not feel the pressure and say, hunger safety net, hold on. But we work together ensuring that we provided that fiscal space and instrument for them. The other aspect is on funding strategy is, can we tap into the local financing at the county level? Because they also have a responsibility in responding to social assistance, responding to disasters, drought, COVID, floods. This. So what as NDMA we were trying to push is legislate locally led financing approaches, what we call FLOCA, that financing locally led climate change action or climate action. And we have managed to do 10 counties that are able to legislate that. They are doing programs. Now we need to pitch within that framework. Can they take off some of the caseloads even on their side so that we are able to work together at county level and the national level? The other aspect is you do legislation, you do the funding strategy, but we need buy-in. So awareness creation among the stakeholders that cash transfer is an investment in human capital development, is an investment in establishing a system that can be rolled on, can be used. It requires private sector to come in, work together, financial inclusion. There are a lot of benefits to it as being evidenced in the report. So awareness creation is very key, and this kind of webinar is a classical example for us to pitch and present and bring on board. And this targeted awareness, especially for the economists and the planners and the political class, is very important because the politicians are the ones who decide the budgetary allocation. The economists and the planners think cash transfer is handout. How do you convince them actually it's investment? So that's a critical area for sustainability for us to do. As the practitioners on the ground who are responsible in actually implementing this, you have to actually showcase that what you are saying is having impact. Evidence of cash transfer system being impactful is very important. So how do you do that? Can you have evidence that you have actually a system working? Do you have impact from a theory of change, like the Equity Bank innovation and transformative payment system is a good evidence. Evidence of beneficiaries actually having impact on them, the cash transfer? Can we show evidence that if we are asked by anybody that whom did you support in this, at a click of button, can we say this household, your reference at this point is the person we supported, is the household we supported, and we have that. Those are the kind of things we need to have evidence as practitioners. Lastly, very important, social accountability, where you bring on board the beneficiaries to part and parcel of the process. So do you have a beneficiary welfare committee that is grounded, informing, and the beneficiaries being part and parcel? So it is holistic from the bottom up to the top, and we move as a team. That has been the approaches for us to ensure that there's sustainability, and we move together and pitch for cash transfer as a program, that it is not a handout, but it's a investment in human capital, investment in system, private sector opportunities, government opportunity, a lot of opportunity for even innovation.
Yeah. Wow, great insights there from you, Jirma, representing Government of Kenya. Seeing questions coming across, whether we will share the video. Yes, we will. We'll share some of the outputs from this webinar, and also continue putting up the questions on the chat. We will soon be moving to question and answer session. So back to you, Anthony. You are back, I believe. So your question is how you plan the exit of this funding that government is now taking over from a larger scale, because also the cash transfer has increased over time, and whether there were any challenges in your exit plans, considering, for example, that the need has grown following the pandemic of the 2 years ago. Anthony?
Yeah, sure. And thank you very much, Milka. I hope you can now hear me.
Yes.
And it's great to see many friends, colleagues, participants joining from all over the world. The question of sustainability is a key one on any development project. And I think for us as the UK, there were 3 key elements that we were looking at in terms of ensuring the sustainability of the project beyond the funding. And the first key element was around the financing of the, social protection in Kenya and HSNP projects. As a very small UK financed pilot, reaching a relatively small amount or small number of households. But over the years, it has grown to be, a large Government of Kenya-led program that is fully financed in terms of cash transfer element by the Government of Kenya. And this has not happened overnight. This has happened through deliberate collaboration between ourselves, the Government of Kenya, other stakeholders such as the World Bank. One, to ensure that we could demonstrate the impact of the project and demonstrate the usefulness, of the project. And 2, to ensure that the project was meeting its delivery objectives in terms of mitigating against drought, but also providing a basic income for the very poorest. So that bit of the sustainability, I think, has been achieved and has been a big factor in terms of ensuring that the project is taken over as an impactful project. The other key element to just mention here is management of the program, because as you will see, all the stakeholders who have joined this webinar, or most, have now left the project, to government to run and manage within its own means. And again, this has been a very deliberate effort to ensure that there is skills transfer, to ensure that all the elements of the project, right from the design to the third and final phase, have been designed in a way that they can be absorbed and they can be incorporated within government systems. And that was key because then government was able, to take all these core elements of the program within its own means. Back to you, Milka.
Thank you, Anthony. Saralina, I'll come back to you and give you a very short time to respond to your last question. There are very interesting questions coming here. This is a very interesting discourse topic, and I think we will need to give time to those that are asking questions on that. So Saralina, I'm back to you on the point that as you implemented this program, were there any unplanned spin-offs, positive spin-offs that arose from the implementation of the program?
Yeah, thank you, Milka. And yes, we had a number of spin-offs, and I think the major one was based on our model around shared prosperity, and that has to do with agency banking. This is within the premise that CBK, or the Central Bank of Kenya, first authorized the use of bank agents in Northern Kenya under the Hunger Safety Net program. And this model has since been scaled to other banks and is also, has also expanded to other regions. And we are using the model as one of our key, onboarding and service points for our customers in Kenya and in the region, meaning that there was quite a bit of uptake and aggressive scale up in terms of setting up the agency network. And looking at where we started off with this concept, and of course, we came up with the design jointly with FSD, where we set up about 50 agents. So looking at 50 agents at the beginning of the Hunger Safety Net program, which we would call the initiator of the concept, to 60,000 agents within Equity, if you were to count or expand that figure to the entire financial service provision fraternity, that would be a huge figure. So that was a spin-off that we didn't quite expect. The acceptability was very high. We have quite a big percentage of our transactions being undertaken through this third-party channels. The next one is about the seeding model, where social safety nets have increasingly become an initiation platform or tool for financial inclusion for the vulnerable households. So they come in under social safety net programming. We take them through social safety net programs, cash transfer executions, and giving them that infrastructure. But in due time, they're able to graduate and become direct customers of the bank. And I think Plun earlier mentioned or took us through the model and how that has evolved over time. So moving from prepaid cards to fully fledged bank accounts. And looking at that model, then we have seen a lot of growth in terms of our beneficiaries. And I hear a repeated call for sustainability, graduation, self-reliance on the conversation. And so this is one of the tools that we have used to then move beneficiaries to a place of economic empowerment, giving them bank accounts, now dealing with them directly and enabling them to use those bank accounts when they want and as they would want, so that then we also give them a bouquet of financial products, and they can perhaps, for example, use their cash flow as collateral for accessing small loans. We start off with probably a small amount of loan, and once you're able to pay that efficiently, we graduate you to the next lot. And we have seen a lot of testimonials that come through in terms of that model, where we extend credit facilities, but again, also the other dynamics that are around coupling that with financial literacy and what have you. So broaden the range of financial products, being able to, the third one that we would talk about is the impact of leveraging public-private collaboration to empower vulnerable households. So that has been a key one, and I think HSNP gave us quite a learning on the power of that when you look at the impact and the gains from this partnership. So that strengthened our resolve to continue leveraging public-private partnerships. There is also the aspect of reusing financial infrastructure for other programs. So when you look at the Hunger Safety Net, and again, this has been highlighted, that model and that level of innovation that we came up with has been reused in the North, and especially where donors or partners want to target the same households. So the partners will come in and leverage that same account, that same card, because we also have a technology and an innovation around using the multi-wallet capability, whether on card or phone. So you come in and put in money through the same account, initially labeled as a HSNP account, put in money on the same card, but a different wallet to take care of issues around the commingling of funds. And that mechanism works well. So that aspect around reusing the financial infrastructure and a number of partners leveraging that infrastructure is also something that really has come up very strongly. So I think that's it for us. There's also the aspect of spreading our presence across the region. We've seen programs around the refugee-based programming, again, that will have borrowed very heavily on the hunger safety net model, other national safety net programs like Inua Jamii, again, borrowing very heavily from this model. So all these gains that have come to us in the social protection space and in the financial inclusion space really have a bearing on our implementation of the hunger safety net program. So the scale up to actually outside Kenya as well, because we have programs that we're also executing outside the country. Again, things that we may not have imagined at that point in time when we were implementing the hunger safety net program. But the discussion has become huge. We have eventually had to expand the department and have a lot of representation across our subsidiaries and across our branches. Persons really just focused on social protection. So it has become a very critical pillar of our business operations. Thank you, Milka.
Oh, thank you. Thank you, Saralyn. I'm coming back to you again quickly, Anthony Njage, about 2 minutes, just to give us your perspective on the impact of this program. How is it different from other programs that are within your portfolio in alleviating poverty in the country?
Yeah, thank you, Milka. So very quickly, because there have been multiple questions, on impact in the chat bar, and we can only measure impact if there are clear goals and targets in terms of the development objectives of the project. And throughout the delivery period of this project, we did set out very clear goals in terms of what to do. One on food security in terms of using cash transfers as an alternative to costly and poorly targeted food aid. And the second one was trying to put in place and working very closely with the government of Kenya to create a shock responsive safety net in terms of drought. So what does the evidence, tell us in terms of impact and comparing that to other projects within the portfolio? First, our program evaluation, which is independent and done by OPM, indicated that HSNP did help households to meet their basic food needs. So that's a tick on the first objective. And in some cases, it covered other essential needs such as school fees and healthcare for the households. The independent evaluation also identified that once households met their immediate needs, there was evidence that they could make small investments in productive assets. So whether it's livestock, especially in the arid and semi-arid lands, they did invest small amounts in productive assets, which is a key indicator of building resilience and helping households participate in the economy. I think a key important impact indicator was on the local economy. HSNP has also been shown to increase the overall incomes within the local economy and has a significant multiplier effect. And then for each shilling injected, we did see incomes rise by an additional 0.38 to 0.9 shillings, creating very vibrant markets that were non-existent within these localities. Finally, HSNP was shown to make households credit-worthy within their local shops, within their localities. And this is very important because it does give them an increased chance of engaging in productive activities. When you have met your basic needs and you're credit-worthy, then you're able to get goods and services that help you produce, whether that's seed for planting, whether that's inputs for farming. And these small economic activities, can be both life-saving and empowering within these arid and semi-arid regions. So those are the 4 key ones that I would like to highlight, also publicly available in a link that I will also share within the chat bar. Back to you, Milka.
Thank you. Thank you, Anthony. My panelists, there's a lot of questions that I would have wanted to continue to ask you, but it's only fair that we also give opportunity to the audience that have asked questions on the chat. And I know that Engineer Jirma, Victor, Plune, I didn't come back to you on the second round, but I'm sure that there will be questions that may need your attention to respond to. So I will now hand you over to Juliet Mburu. Juliet will sample some of the questions, very many questions on the chat. And Juliet, you have about 15 minutes to run this session of question and answer, and then you can return back. I close the session. Juliet.
Okay. Thank you very much, Milka. Yes, like you've said, there's a lot of interest, there's a lot of conversation going on. What I've tried to do is group the questions. So I'll share them out in sort of groups because some of them are repeated and some of them have already been discussed quite extensively. So maybe I will pose the questions around the channel that was used, the channels to Victor, and then we'll go to maybe Sarah Lynn around targeting. There's a lot of questions around targeting, graduation, and safeguarding the beneficiaries. And then to Anthony, we'll talk about going to questions around this $20, how was that arrived at? And also maybe what other models were used when to arrive at the model that was selected. And then Engineer will look at challenges of scaling, and then we'll go to Plune around what are the partnerships with financial sector providers can be adopted going forward. So maybe we'll start with Victor around the channels. So the questions are around why not mobile money? So basically, the participants want to understand why was the agent banking model used and why not mobile money, and why not SACCOs, especially considering how the rural reach of SACCOs. Over to you, Victor.
Thank you. Thank you very much, Juliet. And thank you very much to the participants for this question. I'll just answer this in 4 ways. One, mobile money does or did not, at the time we were evaluating it, offer some of the security features we were looking for. For example, biometrics do offer a level of accountability where you are able to determine there is a human being at the end of this transaction who is alive, because we did introduce things like aliveness on the biometric readers. And we had to also make sure that this process was auditable. You had somebody who physically had to visit an agent and withdraw this cash. These concerns are mainly because social payments have been misused in other parts of the world. We have seen examples, for example, in South Africa, where even people were keeping thumbs of relatives who had passed away so that they would be able to access social payments after they had transitioned. So we're looking for ways to eliminate ghost beneficiaries. The second issue around and why we chose the banking model is because we were able to sign a contract with Equity Bank, and that contract had certain service level agreements. For example, they had to put agencies within a certain distance, walking distance from our beneficiaries. They had to make sure that these beneficiaries had cash during peak times when they needed to pay. They had to make sure these agents were open for business. And strangely enough, when we did some surveys in northern Kenya, we did find that there were no mobile money agents in most of the villages that we were looking to register beneficiaries. And in addition, mobile devices, we did a survey at some point and found only about 20% of our beneficiaries actually had mobile devices or SIM cards. So we went through, I would say, a very rigorous process of evaluating different models. And when we arrived at the agency banking model, which, as Sarah Lee mentioned, was not even on the statutes then, it was the best model that we could identify that would offer, the security, and also would be used by people who are illiterate, because mobile money also assumes that you're able to recognize numbers and are able to key in your PIN, etc. So there were a lot of reasons why we finally settled on the model that used biometrics and the agency banking model. I hope that addresses that question. Thank you.
Yes, thank you, Victor. Over to you, Sarah Lynn. I hope you're there.
Yes, I'm here.
Yes, you are. Okay, great, thanks. A lot of interest around the targeting. What criteria was used to target? How did you ensure that the funds were used for the intended purpose? And also questions around graduation. How do you ensure that, when somebody graduates out of this need, that they actually moved out and they don't continue to be in the program, as well as safeguarding around fraud? So based on the channel that was used, which was Equity Bank, agent banking, if you could just walk us through that.
Yeah, thank you very much for that question. There's a component of that question that I will answer, and there is a component that I would leave to Hussein, to Jirma or FSD team, because our responsibility as far as targeting goes is really minimal. Usually we come in at the point of where the beneficiaries have been selected, taken through community-based validation and those checks that my colleagues would detail in a better way. We come in at the point where then that data is clean to that extent and validated, and they have applied all their poverty index matrices and all those checks and balances that you need to put in place for that targeting journey. So we will open accounts for the beneficiaries at that point, but even as at the point of opening those accounts, we take the data through what we call IPRS, or the Integrated Population Registry, just to ensure that these are real Kenyans, and that also, of course, eliminates a significant proportion of fraudulent activities. So targeting, I would leave that component. But in terms of fraud, I think Victor has mentioned that our model involves biometric authentication at the point of payment, and that then ensures, because you cannot copy biometrics, and in this case, we've been using fingerprints, we'll be having conversations around the FSDO and palm recognition. But at the moment, we know we cannot, copy biometric or fingerprint authentication. So what we did was insert that or embed biometrics to each of the cards that we were issuing to beneficiaries, and again also give our agents a device that was able to read that that template from the card. So in that case, then we were sure that there would be minimal leakages, actually no leakages, because then you are only approved for payment once the authentication journey is actually completed and the device or the system approves you for payment. So from a fraud perspective, that would be it. We have other mechanisms, operational or physical journeys that we have with our partners, and we had back then with FSD, continuing with the same with NDMA against fraudulent activities, but I'll probably narrow down to that technology component. But in terms of targeting, perhaps Engineer Jirma or Victor would address that. And maybe also the issue of graduation, how the mechanism looks like. For us, we bring in tools and solutions in terms of financial literacy training, and that is capacity building, and providing then the capital for those who would want to start businesses, training them and walking a journey with them, just like we'll do with the rest of our customers, and then moving them towards economic independence. Thank you.
Thank you, Sarah Lynn. Maybe Engineer Jirma, if you want to respond to the question around targeting and the graduation.
I will answer the targeting comprehensively so that I'm able to answer to the specifics, since I've not seen the specifics. The approach for the hunger safety net program in the targeting, we approached it as a collective targeting by all cash transfer program, such that we are able to ensure that we mainstream the most vulnerable ones as a program, both the women, the orphans, the elderly, the people with severe disability. So a harmonized targeting methodology tool was developed by all the government cash transfer program. One data set, we picked up the various questions around 68, developed a socioeconomic data, prioritized using a proxy mean test on how they are ranked in as far as poverty is concerned, used the PMT against the standard that the Kenya Integrated Household Budgetary Survey, who are responsible for ranking poverty in Kenya, are responsible for. We shared with them, they looked at it, validated and said, good. The algorithm is good, move ahead. So once we had that, some of the cash transfer program are very categorical. If you are elderly and you are poor and you have been ranked, you are onboarded depending on the caseload that program has in that location. The same with orphans, the same with the vulnerable women, and children and the elderly. Once that is taken up by the other cash transfer program, the hunger safety net now would come and mop up those who have not been picked up by the other caseload, but they are categorical in nature and vulnerable, but they are also poor and potential to be affected by drought and slide into food insecure. So we will pick up that and we'll ensure that it is not double dipping. We spread the resources that if you are picked as a categorical, the other one will be given an opportunity. And as stated by Pauline, this is an area where 70% of the population is very poor. So the difference between one and the other isn't much. So giving even another household an opportunity to tap into one cash transfer program was an approach. If you received from the other cash transfer, can we allow even the other household to tap into, but give priority to multiple vulnerability? For us to ensure that we have identified that, we will validate that with the community. This is what we've generated. This is how the cash transfer program has identified. But can you give us validation? We'll post the list in a public, allow them 5 days to validate, discuss, and then we'll come and have an engagement a mechanism for appeal, and then we will pick up and endorse. So that's how we do targeting for HSNP in conjunction with the other cash transfer program.
Great, thank you. Thank you, very comprehensive response there. Okay, moving on to Anthony. There's a question around how the $20 per household was arrived at. So if you could share some insights on that, as well as in terms of the models that were used. Did you refer to any models, the BRAC model, Ford Foundation model, while developing this program? Over to you.
Yeah, thanks, Juliet, and I'll try and be brief because I can see time is not on our side. In terms of the transfer value, the $20 that is being talked about, and this is a very key element of any cash transfer program, because the transfer value has to match with the aspiration of or the project objective in order for it to be effective. And as I said earlier on, our key objective at the very beginning was food security for the households, and we therefore did look at the rural food poverty line as determined by the surveys then to determine this this transfer value of $20. Over the years, this has been adjusted for inflation. And therefore, currently we are using approximately, I think it's $27, which is about 2,700 Kenya shillings every month to the households. But I think I need to mention here that it's also a delicate balance between achieving sort of the impact or being able to go into depth in terms of the transfer value versus the breadth of the program. Because the needs are so many, and even when you target, the people who are deserving and not receiving the cash transfer remain so many. So, do you give an adequate transfer value to a smaller number of households, or do you try and reach many more households with a lifeline of support? And that is very that is a very delicate balance to try and come up with a conclusion on. I guess the second question is around what models did we use? Cash transfers are not a new thing, especially in the developing world, and we did have a lot of evidence from various areas around the world in terms of how this could be implemented and how this could be contextualized within the local context. So we have had very successful social transfer programs from South America, from East Asia, that provided very good bases or models of how this can be done and how this can be done at scale. We did work very closely with Government of Kenya in terms of just evaluating the evidence, the various programs that provided us with the models, and came to a conclusion on this particular model that we thought would work in this context. I think the other thing to mention is that we did, in conjunction with government, invest very heavily at the beginning in providing the evidence base to ensure that we were providing an evidence base that could be trusted and that was independent in terms of both impact and implementation. Thank you.
Great, thank you, Anthony, for that. And then now moving over to Engineer Jirma. There's questions around what challenges you're seeing when it comes to trying to scale, and this is as more referring to challenges around more money, being able to disperse more money, widening the people that are receiving, the beneficiaries are receiving these funds, and also maybe the frequency of sending out these funds. If you could share with us some insights around that.
The challenges of scaling up during a shock. Definitely there are two key issues that we really need to grapple with. One is a shock comes and suddenly all your coping strategies are undermined. So even if we were giving or planning to give you $27, like in regular, during shock, possibly the 27 will not be adequate because there are other needs. There are multiple hazards, secondary hazards that arises even from one shock. So we gamble with we struggle with the vertical expansion. Should we give additional money on top of the $27 we are giving to the regular? So, and that puts us in a challenge because there are budgetary issues. There's resource allocation, and yet the needs now because of the shock for the household has increased. So the vertical expansion, increasing the transfer value from a certain current value to higher value is an issue. And that has to come with the resource. And as I said, it's very difficult to go back to National Treasury, tell them we have to get additional resources unless we have dedicated financing instrument in place. Is a challenge, and that's why we built up into the National Disaster Risk Financing Strategy for the National Treasury to allow in that flexibility and bringing on board possibly even risk transfer component where insurance can come in based on a predictable, verifiable empirical data that can be used for response. Then the other aspect is the horizontal, bringing on board additional households because the impact of a shock brings more households who are in need. You might be slightly better off than the other, but during a shock, you move up the scale towards poverty. So how do you also accommodate additional household? So that is another challenge, and that has a budgetary implication. The other challenge is, of course, the need for every stakeholder coming on board. One is interested in doing scale up for health. Another stakeholder or sector wants to do for agriculture, for livestock. So during shock, all sectors also have to pitch for resources to respond to. So you as a cash transfer, how do you pitch your case when agriculture is asking, livestock is asking, water is asking, you know, those kind of specific needs. And then when they're asking, they might be asking for from a communal perspective, ensuring that social services is maintained. Whereas you are trying to pitch for a household. The balance between the two, when you are pitching in front of the National Treasury, the political establishment who approve the budget, and competing with stakeholders, I mean with the sectors during shock as a cash transfer, the divide is really difficult. So those are the challenges we face. The problem we had previously was the data, but the growth and the learning from phase 1, phase 2, we were able to solve that aspect of the data, household data. We are able to georeference. Even if a household has moved, we have a reference point. Even if one household has moved and they have moved to a different household, different location, we have integrated our data with the PSP. So the PSP would be able to provide that services even if that household has moved to another location. So that data integration with the PSP, that is the service payment service provider, the linking to the data, georeferencing, having more information about that household, we are able to manage all that. And we've overcome that data and the mobility during scale up.
Thank you very much. Thank you for that. And then maybe the last question to Plun. And this is just around partnerships with other financial service providers. What are we seeing and what can we expect to see going forward?
Thank you, Juliet. I think what we have presented today really demonstrates that PPPs can work. And that's, I think a number of us have spoken to that. It is about what can you bring to the table? What are you best at delivering? So there's a role for everybody to play within the entire ecosystem. Government, as we have seen, they're already doing a lot in terms of developing cash transfers in Kenya. And it's not just about putting in funding, it's also about skill set. It's also about creating an enabling environment. It's it's about county level support. How is it implemented on the ground? We've seen what payment service providers can bring to the table in terms of expertise and already laid out infrastructure. So there's no need. Saralyn has gone into a lot of detail. There's no need to reinvent the wheel, as they say. We've seen the role of payment service managers in such an ecosystem. We've talked about the role of fintechs. I find that they're very flexible in terms of new innovations and laying that out, especially if they have sufficient resources. We've also talked about the donor community. What can they do? We've seen FCDO put in money, EU has put in money, the World Bank also has put in money into this project. And the role also of research in making sure that we are not just picking designs out of the air. These are evidence-based, continuously improving. So there's a role for everybody. We started with one payment bank in northern Kenya. Now there's more than 6 that are delivering payments, cash transfers in northern Kenya. So basically, this is just to say, start with the vision. In mind, so that you have sort of a long-term view. It may be difficult to get in because the business model is not viable. But if you get in with the right mindset and you have a long-term vision, then it's possible to deliver all this. In summary, I think we have a few minutes.
Yeah, a few minutes. Left. Thank you. Thank you so much. Thank you all to all the panelists for responding so comprehensively to the questions. There's a lot more questions that we received, but they will be put together. They'll be uploaded to the video in YouTube, the description. All the questions and responses will be uploaded there. Thank you very much. Back to you, Milka.
Thank you, Juliet. Fantastic opportunity to have had with you. The panelists that are here today sharing your key expertise, quite interesting topics that you have shared with the audience, and I'm sure it will inform future programming of cash transfer program and the wider safety net program on the social protection sector. Engineer Jirma, thank you. Anthony Njage, thank you. Victor Malu, thank you. Saralyn Wairimo and Plume Yunge, thank you for this session. Thank you to FSD team that put this together, led by the communication team and the digital team, bringing this together. Apologies for that slight hitch on the clip, but we shouldn't worry. It will all be posted together with all the outputs that are coming out of this case study into FSD's website. So to look out on FSD's website, not only for this, but for other knowledge products, other webinars and other products that FSD are engaged in. From us, this is it, and thank you. This is a conversation that really require longer time. We realize this, but we do hope that this 2-hour session has helped. We will be posting the webinar presentations and the recording and all other stories that have come out of the case study in our in FSD website. So for now, bye-bye, and thank you all for joining in and participating in this very interesting conversation. Thank you, and bye for now.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you all.